Okay, so we are here with Shay today, and I really wanted Shay to share her story because this has a lot to do with a lot of women, especially women who have IUDs. It's something I find very often as a problem that a lot of females deal with. They often have anywhere from digestive and hormonal problems to low back and pelvic issues, oftentimes because of an IUD. And so Shay's a really good example of this. So Shay, tell me, you had some super bad pain, if I remember correctly, so correct me if I'm wrong, you had some super bad pain, pelvic pain, like sciatic nerve-ish type issues since August of last year, is that right?
That's right.
Okay, and then so somehow you found your way here, and we started doing our applied kinesiology / systems healthcare evaluation with you and found that you had some gallbladder stuff, right?
We did,
and
first
then,
day.
Yeah, and so we had some gallbladder issues, and then eventually it led us to the uterus, and I asked you if you had an IUD, and you said yes, and then began the wonderful little process of getting all that taken care of. So have you had this type of muscle testing and stuff like that done before?
Well, when I was younger, my mom was into similar things, but not at this level.
Okay. And then tell me this, did you have, we found a lot of pelvic muscles malfunctioning on you, so obviously they couldn't stabilize your pelvis. So I told you had to have your IUD out, that was part of your problem because of the hormones not only because of the IUD, but the hormones that those IUD was releasing, the estrogens, were negatively impacting your gallbladder. So you have this quack doc, right, that tells you need to go have your IUD out. So tell me what happened when you went and had that done.
Well, I went in kind of on faith, I'll be honest. I was like, I'm not sure if this is really going to help. But I'm not kidding. When I got in there, the doctor tried to talk me out of it.
Right.
And I just kept just saying, nope, I'm going to do this. And when she got in there, she's like, oh boy, it's actually kind of a mess in here and you need to have it out today.
Yeah.
So I can tell you within a few hours of having it out, I already started having some relief of pain.
Isn't that crazy? So we see that quite often, is that the stress in the uterus, since the uterus, there's muscles associated with uterine function. Muscles are in a female, it's the muscles like the glute muscles and other pelvic related muscles that will short circuit when there's stress on the uterus, which is what we found with you. And so they kind of confirmed what we found through our system, through muscle testing. And what was it? Was it one of the docs there that asked you if you should go see an energy medicine doctor or something like that?
Yeah, when I was having an ultrasound, they sent me in just to check everything else. She's like, I just have been watching these podcasts and you need to go have some energy work done. And she said half the time it's on the opposite side of the body of what you think is wrong. And once I told her about you, she was like, my gosh, this is awesome. So it was
cool.
pretty crazy.
So you can find some great stuff with just muscle testing alone. If it's done properly, you can find out a lot of good information. So you noticed a big shift in the pain and it started to feel better, even immediately after it was removed.
And this morning, honestly, more than 50% better after one day.
Right.
And I've been miserable for 4 months.
And just for video's sake, you had this out yesterday afternoon. You had this removed yesterday afternoon, so we're having you back in here this morning to kind of reset some stuff. So that's cool.
Yeah.
Well, very cool. Well, thanks for sharing. Appreciate it.
Thank you.